Hi guys, so I thought I'd come to you today to answer some of your questions about oral minoxidil. The response to the New York Times article has been honestly overwhelming, and I've gotten a ton of great questions about minoxidil. So I just wanted to film this quick video and just give you some information about the medication. So first, what is minoxidil? Well, minoxidil in its topical formulation is the only FDA approved treatment for male or female pattern thinning. And that is the formulation that most people are familiar with it. Rogaine is one brand that you can find producing minoxidil, but minoxidil is actually available in many generic brands over the counter. The significance of oral minoxidil is that oral minoxidil is only FDA approved to treat high blood pressure, especially when you dose it between 10 and 40 milligrams a day. At low doses, starting as low as 0.625 milligrams a day, it has been shown as a very effective treatment for male and female pattern thinning. Why? Well, there's this enzyme called sulfosyltransferase. Sulfosyltransferase is required to activate minoxidil from its basic form to its active form, which is called minoxidil sulfate. Only some people have enough sulfosyltransferase activity in their skin to make topical minoxidil effective. In fact, you can predict who will respond to topical minoxidil by measuring the sulfosyltransferase activity levels. You can't actually do this in a clinical setting, but it has been shown in a scientific study that this is the case. But when you take minoxidil by mouth, it's automatically activated to minoxidil sulfate. So even those patients who would not respond to the topical minoxidil are excellent candidates for oral minoxidil. So two, how do you know if you're a candidate for minoxidil? Well, it first requires a diagnosis by a board-certified dermatologist. Minoxidil is only effective for a type of hair loss called androgenetic alopecia. That's better known as male or female pattern thinning. In fact, if you have severe hair loss due to other conditions, minoxidil is actually not going to work at all. So that's the first thing that you have to do if you want to determine if you are a candidate. So let's say that you do have that diagnosis, you know that you have male or female pattern thinning. Is minoxidil right for you? Well, I think of minoxidil as effective and appropriate for kind of a narrow range of individuals with male or female pattern thinning. For men, it's most effective if you're using it and you're still thinning, but you're not necessarily bald. Any parts of the scalp that are very shiny and smooth, unfortunately, the process is too far along at that point for minoxidil to be effective. But if you are simply thinning, it actually can be a great medical option for you. For women who have androgenetic alopecia, it is most appropriate if you have moderate to severe female pattern thinning, similar to the patient that I presented in the New York Times image. It's not an appropriate treatment for someone who's simply trying to prevent hair thinning or has noticed gradual decreased density over time, because just having a thinner ponytail is actually a natural part of aging. And in those patients, minoxidil doesn't tend to do that much. So for women, you really want to have visible thinning such that you're inclined to either wear a wig or to apply hair filler fibers. Third, what are some of the upsides of oral minoxidil compared to some of the other treatments that are out today? Well, there are two oral treatments that are also commonly used for male and female pattern thinning. One is finasteride. Some people refer to it by its brand name, Propecia. Finasteride is a very effective treatment for androgenetic alopecia. It is FDA approved for this condition in men only, and it unfortunately really only works in men, especially at the approved FDA dosing. However, finasteride can have hormonal side effects. So when I'm prescribing a medication to a young man who seems to be having kind of rapidly progressing male pattern thinning, I do prefer minoxidil to finasteride because I really want to avoid some of those sexual side effects like sexual dysfunction, decreased libido, and affecting their sperm quality. As far as women, one medication that's used off-label by several dermatologists for female pattern thinning is spironolactone, and it works by blocking the effects of male hormones on the skin and hair. We use it very commonly for acne. It's incredibly effective for this reason. I find that spironolactone tends to be most effective for women with a diagnosis of PCOS or those who have elevated testosterone levels, and tends to be slightly less effective for women with female pattern thinning who are perimenopausal or postmenopausal. So in that population, I also prefer to use oral minoxidil as well. So finally, I really encourage those of you who feel very eager to start oral minoxidil to schedule an appointment with a dermatologist, even if it takes a few months to get in, because so many of us are so booked. It is worth the wait, because just a few months is not going to eliminate your candidacy for oral minoxidil. Hopefully I've answered some of your most important questions. I will try to put up a blog post about this so that that information is more readily available. There are several dermatologists who have also contributed to the New York Times paper, as well as are part of the American Academy of Dermatology, American Hair Research Society, who also feel very comfortable prescribing minoxidil. So if you are looking for a dermatologist who's interested in hair loss, you can go to the American Academy of Dermatology website and search for a hair loss specialist. You can also do the same through the American Hair Research Society. I hope you guys have a great day. Bye.